As soon as you start trying to get pregnant, or you have a positive pregnancy test, there are things that you should stop to ensure that your baby will grow and develop properly and healthy. In this video, we are going to talk about the things you should stop immediately as soon as you find out you are pregnant. Ready? Let's begin. 1. Stop smoking. Smoking during pregnancy affects you and your baby's health, before, during, and after your baby is born. The nicotine, carbon monoxide, and many other chemicals you inhale from a cigarette while you smoke, are carried through your bloodstream and go directly to your baby. Smoking while pregnant has the following effects. Lower the amount of oxygen available to you and your growing baby. Your baby's heart rate increases. The chances of miscarriages and stillbirth are drastically increased. The risk that your baby is born prematurely or born with low birth weight is also increased. The risk of developing lung diseases in your baby are increased as well. Increased risk for birth defects. Your baby has a higher risk of sudden infant death syndrome after born. 2. Stop drinking alcohol. Alcohol is one of the many substances that can have a negative impact on fetal development. When a pregnant woman drinks, it not only affects her, but also all the developing organs in the baby. Any amount of alcohol can reach the baby through the placenta and cause serious harm. According to the Centers for Disease Control and Prevention (CDC), drinking alcohol during pregnancy can adversely affect the physical and mental growth and development of a baby. Drinking alcohol during pregnancy is also associated with fetal alcohol spectrum disorders (FASDs), which is a group of irreversible diseases that cause physical abnormalities and impair mental, psychological, behavioral, and cognitive development in the baby. 3. Stop recreational drugs immediately. Recreational or illicit drugs can be very harmful to a developing baby and may decrease drastically the chances of survival. Drug use by a pregnant woman can cause serious health problems for the unborn baby. Here is a list of some illicit drugs and the effects they can have on a fetus. Amphetamines. The use of these drugs are linked to heart defects, an increased risk of placental problems, as well as miscarriages, preterm birth, and low birth weight. Cocaine. Cocaine use can cause contractions of the uterus, which might lead to bleeding complications or premature labor. Cocaine can cause stillbirth, miscarriage, preterm birth, growth retardation, and birth defects in babies. Marijuana. Increased risk for impaired fetal growth, miscarriage, preterm birth, developmental delays, and even learning disabilities. Narcotics. Drugs such as heroin can cause growth problems, premature labor, and a fatal syndrome of narcotic withdrawal after birth. In addition, sudden infant death syndrome (SIDS) is more likely among babies whose mothers used narcotics during pregnancy. Tranquilizers. Tranquilizers such as Valium have been associated with birth defects. Mothers who engage in heavy use of tranquilizers during pregnancy can also have babies who undergo withdrawal symptoms after birth. Glues and solvents. Women who sniff fumes during pregnancy may suffer a miscarriage or preterm labor and birth. They can have babies with birth defects including low weight, short height, joint and limb problems, heart defects, and abnormal facial features. Ecstasy. Pregnant women who use this drug might have babies with long-term learning and memory problems. 4. Reduce caffeine intake during pregnancy. The evidence seems to suggest that consuming caffeine in small amounts, for example, 1 cup of coffee a day, poses little or no risk to a fetus. However, some evidence suggests that drinking more than 7 cups of coffee a day may increase the risk of having a stillbirth, premature birth, baby with low birth weight, or a miscarriage. 5. Avoid taking over-the-counter medications. With pregnancy, many symptoms and pains will be part of your life for 9 months. Even if you feel the need to take medications, you must check with your doctor first, to be advised about the medications that are safe for you to take during pregnancy. Usually when you go to the first prenatal appointment, the doctor will provide you with an informational package, with all the things you can and can't do, and usually, in that package, you will find the list of medications you are allowed to take during pregnancy. Remember that although medications are not a recreational drug, they still contain chemicals, and all chemicals passes from your blood through the placenta to your baby. 6. Avoid the consumption of processed meat and unpasteurized dairy products. To minimize or avoid the risk for listeria, avoid foods that most likely carry it, such as certain types of processed meats, unless they've been thoroughly heated or cooked. Smoked fish, soft cheeses and unpasteurized milk or dairy products. Unpasteurized dairy product can expose you and your baby to certain harmful bacteria, so it's important to read labels very closely while you're expecting. For example, many soft kinds of cheese are usually unpasteurized, and these can be a vehicle for Listeria and Campylobacter pathogens to enter in your body. These bacteria can cause severe illnesses, particularly during pregnancy when your immunity is down, and they may even threaten your baby's life. Food safety during pregnancy begins with careful shopping, and a good understanding of how and where bacteria tend to breed. 7. Avoid exposure to radiation. There are two kinds of radiation exposure that pregnant women needs to know about. The first is called non-ionizing radiation, which comes from household appliances such as microwave, ovens and TVs. The second is ionizing radiation, and it comes from X-rays. Ionizing radiation risks throughout pregnancy are related to the stage of pregnancy and the absorbed dose of radiation. Potential radiation effects may vary, depending on the fetal stage of development and the magnitude of the dose. These risks are more significant during organogenesis, which is the organ developing period, mainly during the first trimester. These risks are much lower in the second and third trimesters. Avoid all exposure you might have with CT, MRI, or X-rays. The potential biological effects of in-uterus radiation exposure of a developing fetus include prenatal death, intrauterine growth restriction, small head size, mental retardation, organ malformation, and childhood cancer. The risk of each effect obviously depends on the gestational age at the time of the exposure. Regarding the non-ionizing radiation, don't worry too much about radiation exposure from home appliances and communication equipment. The levels are so low that more likely your baby will not get affected. However, it's always good to have some precautions, such as sit at least 5 feet away from the TV when it's on, and stand at least 3 feet away and to the side when your microwave is running. 8. Avoid exposure to harmful chemicals and pesticides. In the first trimester of your pregnancy, your baby's nervous system is actively developing. Having contact with pesticides early in your pregnancy could seriously damage your baby's development and well-being. Therefore, pesticides should be avoided at all costs. If you can't, at least try to minimize your exposure as much as possible. Also be careful with immunizations. Any vaccinations that use live viruses are avoided during pregnancy, including rubella, measles, mumps and yellow fever. It is vital that you make your doctor aware that you are pregnant, prior to having any immunizations. Only 2 vaccines are specifically recommended for pregnant women, and those are the flu or influenza, which should be given during the first or second trimester of pregnancy, and the TDAP or tetanus diphtheria acellular pertussis vaccine, usually given from 27 to 36 weeks pregnant to prevent whooping cough, also known as pertussis. 9. And finally, for all the kitten mommies, be aware of toxoplasmosis. Be cautious and follow these helpful tips to reduce your risk of environmental exposure to toxoplasma. Avoid changing cat litter as much as possible if you can. If you have to do it, wear disposable gloves and wash your hands with soap and water afterward. Make sure the cat litter box is changed daily. The toxoplasma parasite does not become infectious until 1 to 5 days after it is shed in a cat's feces. Feed your cat only with commercial dry or canned foods only, never feed him raw or undercooked meats. Keep cats indoors if possible. Avoid stray cats, especially kittens. Avoid getting a new cat while you are pregnant. Keep outdoor sandboxes covered to limit spreading any infection. Wear gloves always when gardening or during contact with soil or sand because it might be contaminated with cat feces that contain toxoplasma. Wash hands with soap and water after gardening or contact with soil or sand. In conclusion, the first trimester is a period of major development for your fetus and a profound physical and emotional change for you. In general, as soon as you know you are pregnant, you need to eliminate everything you know that puts your baby at risk. Try to maintain a healthy lifestyle, drink plenty of water, rest properly and exercise. And most of all, trust your instincts. Avoid exposing yourself to chemicals, medications or drugs. And get ready to start visiting your doctor for your routine checkups as soon as possible. I hope this video was helpful to you. If it was, don't forget to subscribe to our channel for more useful information about pregnancy and motherhood. Thanks for watching.